All right. So thank you all again for joining us tonight. I am excited to be to talk about what we have going on. We have so many things, so many exciting things to discuss with the Medicaid information that we're going to learn tonight. I apologize. I'm trying to pull my, I don't know where my slides went here. There we are. Let me share my screen. Okay, so I'm hoping you see the big screen there with our title. All right. Well, I am Jenna Wells. I am the Senior Community Outreach Coordinator at the USAID, which stands for the University of Cincinnati Center for Excellence in Developmental Disabilities. I know it's a long title, so we just call it USAID. We have a lot of different programming within our organization. And I'm going to go through those real briefly and just tell you a little bit about us and then what you can expect from us. And also, we'll have some housekeeping rules here and guidelines before we start the full session. But as you can see in the slide here, we are the University of Cincinnati Center for Excellence in Developmental Disabilities. We do a lot of different things within our organization. One of the things that we really try and make sure happens is collaboration across the board with our community partners, with families, and we like to learn together with all of the above. In our policymakers, we certainly have we do our research and policy. We have information sharing, this is an example of one of the ways that we do information sharing. We have a lot of different sessions that we hold. We do trainings. I'm going to talk about a little bit about our support parent trainings, but we also do trainings for professionals and businesses and anyone that wants to learn about how to include individuals with disabilities or special health care needs. And then that community collaboration, like I mentioned, and honestly, that should be in the middle because I feel like that is our outreach and making sure that we partner with everyone within this state. We are a statewide program, so we certainly want to do our due diligence and understand what is out there and available for families. Just to hone in a little bit on a couple of programs that we have, Ohio F to F is Ohio Family to Family and Ohio Parent to Parent. Those are our two family support programs. I actually work in both of them. I'm the coordinator for P2P, but I'm also a family support specialist for F to F. So these two programs are kind of similar. Family to Family is one-on-one family support. We provide that support for families that are really trying to navigate the various systems. And those systems, it can be the medical systems, it can be the educational systems, it can be statewide systems, federal systems, whatever it might be. We can help families navigate through what is all out there for them and individualize the needs that they have. And then our parent-to-parent program is a peer mentoring program where we connect families together that have similar experiences. We train them We train family members to be peer mentors, and then we connect them with the referrals that come through of family members that may be just looking for a peer that gets it. And as we all know, this can be a lonely journey sometimes, and it really helps to be able to connect with other people that understand, especially somebody that has been through a similar experience. So we make matches in that program based on lots of different things. It can be their diagnosis, it can be maybe a surgery that they plan to go through soon. It can be based on educational needs if they're really wanting to talk with a peer that has been through the IEP process and understands the law, or maybe they just need a listening ear. So we train peer mentors to do that. So, and then all of our programs are free. So anyone is welcome, and there's really no eligibility requirements other than you have a loved one with a disability or special health care need. So it's pretty easy to get into our programs, especially our family support programs. So hopefully we'll see some of you there. All right, so I am going to stop sharing that and speak briefly. So tonight, like I mentioned, we are hosting this about Medicaid for youth with disabilities. We have some wonderful speakers with us tonight. Just so you know, you're welcome to put your questions as we go through this information. I know it can be a lot, and sometimes it's hard to remember our questions as we go. So as you think of questions, feel free to put them into the chat. And then at the end of the session, we'll go through the chat and we'll have a little bit more of an open discussion as well. You're welcome to raise your hand at the end as well. Whatever works best for you, but we can certainly answer all of your questions at that point. We also ask that you do not use names when you are asking questions, simply for HIPAA rules, and we want to make sure that the information that we're providing is for all of those that are attending, but it's usually the case if you have a question, other people probably have the same question. So we love questions and we all learn from them. So by all means, please ask away. There is, for accessibility, if you are needing to use where is it now? Because I don't even see it on the captions. Oh yes, here it is. So you should see captions on the bottom of your screen. If you need help setting up the captions or utilizing the captions, by all means, let me know. I'm happy to help anyone work through any challenges with that, but feel free to use the captions as needed. And then just briefly, there will be a survey at the end. I know that we're all surveyed out. I actually wish I didn't even have to ask you to do the survey, but unfortunately with our grants and we really do want to learn from you and get the feedback from you on how we can make these better. So please complete the survey at the end if you can. It should only take you a few minutes to complete. And I will send, this is recorded, so I will send this out. If you need this later, I will be sending this via email to you later as well after the session. All right. I think that's all of my housekeeping. I'm going to turn it over to Teresa Schlemmer. She is here from Hamilton County DDS, and she is going to open us up tonight. Thanks, Teresa, for being here.
Thanks, Jenna. Good evening, everyone. I am Teresa Schlemmer. I work for Hamilton County DDS. I have been there 18 years. In my current role, which I have been in for 5, I do Social Security applications, help you navigate Social Security overpayments, If there's issues with your Social Security check, I navigate through them, as well as I do benefit analysis to tell you how, when you go to work income impacts not only your check from Social Security, but also your Medicaid, which is very important, especially for those folks that might have a child on a waiver. With that being said, I'm going to tell you, first of all, the difference between Social Security and SSI. I know if you've ever had to apply for Social Security benefits online, it's a little bit of confusion because it says Social Security disability. So you go on there and you apply for your child, but then you get denied and you're like, well, I was denied, my child was denied disability. Social Security is based on work. That's the FICA that we pay out of our paychecks each week. If you do not have qualifying quarters with FICA, you do not qualify for Social Security. Social Security is not for children with disabilities because they have no work records. However, if they were old enough or a parent has passed away prior to 18 and 1 month, they could potentially qualify for benefits off of a parent's work record, but that's on Social Security. So that's just a little snippet. What I want to talk about more is SSI. So SSI is Social Security income. That is a needs-based program. At age 18 and 1 month, you can apply for your child because your income no longer counts. Prior to 18 and 1 month, most children are denied SSI benefits because parents' income counts. It throws them over the income limit for the household. But at 18 and 1 month, Social Security views a child as an adult, and so they can apply on your own. I do that in-house here for anybody that's served by DDS. My application process can take anywhere from an hour to an hour and a half. However, if you are not served by Hamilton County DDS, you can call the Social Security office when your child is 18 and 1 month. You could even call a little bit earlier than that just to make sure you get an appointment right away. Social Security is still not taking walk-ins. Everything is by appointment only. So you would have to call to make that appointment to apply for benefits. Surprisingly enough, even though I work for Hamilton County DD Services, I still have some cases, not the majority by any means, that Social Security does not approve them. They have a very strict guidelines, and the guidelines are becoming more strict every day because there's been noted a lot of fraud with people applying for either Social Security or SSI benefits. So they're really cracking down on that. Most people who have a dual diagnosis disability do get approved. It is a process that takes between 200 to 240 days for a decision to be made after your application is done with the Social Security office or myself. This year for 2026, the maximum anyone can get on SSI is $994. It coincides with Medicaid. Once you're approved for SSI, you are automatically approved for Medicaid. And Diane will get into the Medicaid benefits after I am finished. It does have a resource limit of $2,000. That is a combined resource limit. That is for any resource you have in the child's name that can be cashed in about 3 to 5 days. CDs, annuities, 401ks, checking accounts, savings accounts. And we are able to navigate with you through that if you feel like you want to save some of that money. Work does impact your SSI check, but it's better for them to work when you're on SSI. They will put more money in their pocket than by just getting an SSI check. Trying to think what else y'all might need to know. The process is pretty grueling I'm not going to lie, pretty grueling at the Social Security office. If you do decide, Jenna's going to put my and Di's email in the mailbox. If you decide that you have to go through the Social Security office because you're not served by DDS, Hamilton County Developmental Disability Services, I'd be happy to send you a list to show you what you need to take to the office with you. It'll be much better for you to be prepared than to have a delay in the processing of your application. For SSI, child has to apply on their own. Yes, the child has to apply on their own, but they only are eligible after 18 and 1 month to apply on their own. That's how that works. Otherwise, parents' income counts, Steve, prior to 18 and 1 month. Your income would count, mom's income would count. That doesn't mean they have to go there by themselves, by the way. You can assist them in going to the application meeting. But Social Security will be requesting information from them. They'll need to know their bank account and do they work and, are they married, et cetera, et cetera. Where do they go to the doctor? Where have they been to the doctor? Are they on medication? Things of that nature. In addition, I'm going to tell you this, when you as a parent, if you are working and you decide to retire, and your child is on SSI, one thing that you need to make a note of for down the road is that you tell the Social Security office that you do have a child with a disability who is on SSI, and there is a potential that they could also have a draw off of your check. Your check is not impacted. So say your child, you retired, you get $4,000 a month. You would still get your 4,000, but your child would get 2,000. But that's only when you're on Social Security and you are drawing your check. Okay. That's not SSI. SSI makes the disability determination. So everybody who is in the disability field, in the disability world, must be determined disabled by SSI. Social Security never makes that disability decision. That is all comes from the SS side at the Social Security office. Questions? Did I miss something? Did I go too fast? I know I talk really fast.
Teresa, can you tell us a little bit about the paperwork that we need when we're going through the application
Yeah,
process?
they asked for such things as where was like hospitalization, like who made the disability determination. Most of the time it is Children's Hospital in my experience here in Cincinnati. Most children get their disability determination either from their primary doctor or from a hospital such as Children's Hospital. They also asked you to bring a list of their IEPs. If they're served by any kind of DDS, there should have been an OEDI and a COEDI, which we determine disability, the need for disability services. There's also what's called a FED form and also talks about disability. They just are looking for a lot of proof to support the disability. They ask about their finances and their schooling as well during that process. I see we got some other questions too, Jenna.
Yes.
Charlene, can you clarify for a child who is a full or a significant developed, will still
So
need it?
Charlene's
Yes,
question for everyone is, for example, for a child who is full care or has significant developmental delays, that will still be present at 18.
yes. If you
Yeah.
have to go to the Social Security office, Charlene, unless you are their court-appointed legal guardian, the child must be present at the time of the application. Even my nonverbal people, they have to be present to talk to Social Security. Now, once you're there, you can speak on their behalf. Obviously, there's some leeway there. Um, but yeah, the child would still have to be present for the beginning of the application anyway. Some of the caseworkers at Social Security say like two parents go. I've seen this happen. Two parents go to apply at the Social Security office, and after the child's there a while and they know that this isn't going good for the child, they might let dad leave and take the child away, and then mom completes the application or whatever the scenario is. But the child actually has to sign the application if they are not the court-appointed legal guardian, if the parents are not the court-appointed legal guardian, or some entities such as Jobs and Family Services. We have an agency here called APSI, and they are guardians of some of our people. Those people have to sign that application, not our individual. And in which case, then the individual doesn't even need to attend that appointment, just the court-appointed legal guardian. Okay.
Steve is asking, is this when and where the doctor expert evaluation form is used?
At the application? Well, here's what happens, Steve. You apply, they send you certain things in the mail. One is a form that discussed their daily living, like do they need prompting to brush their teeth? How far do you let them walk without authority? Do you let them cook? That's called an adult function report. The other step that Social Security does is most people are required to go to one of their doctors and have an evaluation done. These doctors are very efficient at disability determinations. That's all they do. They're part of Social Security staff. Basically, they're hired through them, and they do an expert evaluation. There's really no per se form for that. If you can get them as much information from the doctors as you possibly can prior to your going to your appointment, it helps them expedite your application. However, when you are at that appointment, you will fill out a form giving them consent to reach out for all medical records from each provider. Does that help, Steve?
Yes,
You're welcome.
thanks.
Okay, I see Nicole. If you apply online, do you still have to go to the Social Security office? Currently, you cannot apply for SSI online. When you see Social Security disability income online, that is referring to anybody who has work credits. You or I, who all of a sudden tomorrow we're at work and we trip and we get hurt and we have a disability now, but we have work records. That's what we can draw from. SSI is a needs-based program and you cannot apply online. I have people, we work remote from home in Hamilton County DDS. We work from home. On Tuesdays, I go into my office and the people have to physically come in there because I have to see them and they physically have to sign documentation. Excuse me. They do not allow wet electronic signatures, e-sign. Any of that is not permitted by the, SSI office. You will still have to go in eventually.
So Teresa, just so I understand, if a family goes and applies through you, then they don't have to go to the Social Security office.
Right. I am in lieu thereof, but I
I
only
see.
do that for people that Hamilton
For
County
Hamilton
DDS
County.
does it.
Do
Yes.
you know if other DDS is there a person like you within other DDS
There
system?
is none that I'm aware of at any other DDS county in the state of Ohio.
I see. Okay. Good to know. Good to know.
Bo has
Um,
a question. Is there a
mhm.
maximum amount to the earned income an applicant can make to remain qualified for SSI or Medicaid? So, Bo, once they are approved for SSI, when you work does impact your SSI check, but in the state of Ohio, there's a rule called 1619B. You received one SSI check once upon a time. Social Security still finds you disabled and you utilize your Medicaid. And that's just simply going to the doctor, using your Medicaid card there or prescription. If your check goes to zero because you've worked so much, you just go into non-pay status. 1619B kicks in and you're still Medicaid eligible as long as your resources are under $2,000. There is no maximum income on SSI.
Yeah, can you tell us a little bit more about how they determine the total amount that one would receive from
On
SSI?
SSI, it's 994 across the board.
Oh, okay. So if you qualify, you get 994.
Unless you work, then your work would impact that.
I see.
You also have to show that you contribute a minimum of one-third household expenses. Um, Otherwise, they say this is in Congress right now to get this waived, actually. They reduce your check by one-third because if you cannot afford the household experience based on your 1990 or your 994, somebody has to be supporting you. So they reduce your initial 994 down to 662 for 2026. But if you tell them that they're contributing to the household, not above what they can afford, and you have to really show that that's what the household expenses were. If you are a family of three and your mortgage is already $3,000, one-third of that's 1,000. So they're already not able to contribute their fair share to the household because they only have $994. You haven't even talked about food or electric or anything. So they would give them the 662 at that point instead of the 994. Bo, do you live in Hamilton County? Your name looks awfully familiar. Does DDS serve your child? Yes. Thank you. I think we are also your child's authorized rep. You can reach out to your SSA and we can discuss further if you have more in-depth questions about what you're asking me. Just reach out to your SSA here at Hamilton County DDS and we can set up a Zoom meeting and we can go into more depth if that helps you. You're welcome.
Okay. I think we might have missed one of Charlene's. Maybe you said this and I missed it, but how does it work if a child isn't able to complete the application process when 18?
What do you mean isn't able? Can we clarify that, Charlene? Because they wouldn't have to complete nothing. They would just have to attend. They would just have to make an appointment, go to the office, and then somebody could speak on their behalf. Let me see what she's saying here. I
Oh,
already answered it. Okay, great. Thanks, Charlene, for
perfect.
clarifying.
Just wanted to make sure.
Yeah,
Okay.
I want you to make sure too. So with knowing that SSI, you automatically get Medicaid. I'm just going to mute myself. If you think of something else, I'm not going anywhere. I can answer at the end, but I'm going to let Di jump in at this point. Thank you all for your attention, and I won't be going anywhere. I promise.
Thanks, Teresa.
You're welcome.
Thank you, Teresa. That's awesome. So I do want to introduce myself. My name is Diane Sunderman. I work with Teresa on our benefits team here at Hamilton County DD Services. And when I say benefits team, I mean we maintain, obtain, monitor benefits for the people that we serve. We're not working for the employees of Hamilton County DDS. We're working for the people that we support. So we help them get Medicaid, Medicare, Social Security income, SNAP, food assistance, a plethora of government benefits. And we do that in an effort to help our youth who are transitioning into adulthood be able to live in their communities without possibly living in facilities, to maybe be able to one day move into an apartment or a shared living situation or a group home, so that those benefits can assist their personal budget, and that they'd be able to live as independently and as safely as possible. So, with that said, I do want to give gratitude and thanks. Teresa actually uh, was approached by Social Security back in 2021 during the COVID pandemic. They were, due to the nobody's allowed in your building syndrome, the first couple years, they were offering certification to different CWIC consultants, which Teresa is one. She can do, like she said, the benefits analysis for people. They were offering this certification to be a Social Security liaison, meaning she works as a Social Security agent, but she is a liaison to someone at Social Security. So she does have to follow all the guidelines that Social Security uses. But we are so privileged and blessed to have her in our county because sometimes the wait time to get an appointment is very long. And Teresa is able to maybe accommodate you a little sooner. It doesn't mean your application might be approved or processed any sooner, but you can get in and get your appointment. And Teresa has a very high success rate. So the people in Hamilton County are truly blessed to have her in our agency, and there are no other. They stopped doing that after a year or so because then Social Security started reopening their offices. I think there might just be a handful of Social Security liaisons, around the state. There are some within the country, but Teresa travels for conferences and has to remain certified all the time. So thank you, Teresa, for going above and beyond to provide that service to the people we support. So, my role at Hamilton County DDS, I've been there, I think it's coming on 25 years now, and I've played different positions all throughout the agency, but the bulk of my time has been on the benefits team, either as a benefits representative, which is where I started my Medicaid training, and then I was an SSA for about 5 years. I worked with a more geriatric group of people who lived in supervised group homes. And then I came back to the benefits team as a manager. And I'm very blessed with a very astute team and very knowledgeable team of people who support our individuals. So with that said, the crux of the information that we help people with is getting different government benefits. And I'm going to talk about each one. And then if you have any questions, please put them in the chat. Just remember not to use names because this is being recorded and we wouldn't want any PHI or HIPAA information breached. And then my information also will be provided to you by Jenna. You can, even if you don't live in Hamilton County, Ohio, you can reach out to me using my contact information and just tell me we met at this meeting and we can talk a little bit more. In the state of Ohio, we have a state health insurance called Medicaid. Medicaid is quite often confused with Medicare, C-A-R-E. Medicaid is the state-based financial needs-based health insurance. And this is for people who are 150% inside the federal poverty level and are not able to obtain regular health insurance through employment or through the open marketplace. Maybe they don't have enough income for that. Medicaid is also used in tandem, as Teresa said, with SSI, Social Security income. This is a supplement. This is for people who aren't able to work and get an income, but they still are required to pay for their living expenses. So by going through the SSI application in the process, one, you're being deemed that you have a disability, but two, you're being given awarded monthly monies to help support yourself in an apartment, in a residential setting, maybe metropolitan housing. And because you've already proven through to Social Security that you have a disability and you get the SSI, you automatically are enrolled in Medicaid. About 10 years ago, Medicaid and Social Security SSI kind of matched a lot of their criteria. And the biggest criterion for SSI and Medicaid is if you are not working, your total accessible resources cannot be more than $2,000. And this means anything that is in your name, a bank account, a savings account, a checking account, stocks, bonds, CDs, IRAs, annuities, cash value of a life insurance policy. The person owns the life insurance policy. It's an investment type policy. Those are called whole life. As you make your payments every month, every year, it does accrue a value that you get when the policy is paid out. And that's an accessible fund. You can borrow against that. You can apply for that. So your resource limit can never be more than $2,000. I'm going to talk about another Medicaid program later where that is different, but for the purpose of transitioning adults, since the children are going into adulthood and have not truly earned a lot of money or aren't going to be in a position maybe right away to earn a lot of money, you're going to want to maintain their resource limit to maintain their health insurance. Medicaid can be obtained to children under the age of 18 if their parents' income combined meets that 150% federal poverty level. Then they would be eligible for the Medicaid based on the household income. So we do have cases where that happens. But for the transitioning youth, when they move into adulthood and at age 18 and 1 month, they go to Social Security and they apply for SSI and they're approved and they start getting a monthly check. They are also getting Medicaid, their state health insurance. This is also very important if you're working with your local DD services office and you're trying to get a state waiver. Maybe you're trying to get Ohio Rise or a DODD waiver, the Department of Developmental Disabilities waiver, or a home care waiver if you have someone who has skilled nursing needs as an adult, a young adult. So the reason that the Medicaid is required is Medicaid is health insurance, but it's also the funding. It's the funding that pays for your waiver services. So if you're on a level 1 waiver or an IO waiver or a self waiver through DODD, you have to maintain the Medicaid. You have to keep that in good standing because your provider of services bill Medicaid to pay for their services they're providing for your child. So it actually serves as two forms: health insurance, which is very important. It can pay for hospitalization, medical visits to medical providers. It can also help pay for prescriptions. It can be used in tandem with private health insurance if you're employed and your children are allowed to stay on your health insurance until the age of 26. You can have both. If you're retired and you get Medicare and your child eventually is eligible for Medicare because they've been receiving their SSD income from based on your work record for 24 months. You know, we have a lot of people who are like, my child's 22 and he just got Medicare. How is that possible? It's not just for the aged, it's for the aged and disabled. So if you're meeting certain criteria, you can get on the federal health insurance program called Medicare. But just remember, those who use Medicaid, Medicaid is always the payer of last resort. Going to ask you to remember that. Medicaid is the payer of last resort. So the way it works is you would go take your child who has all these different types of health insurances. I just tell parents, take everything they have. Let the billing office figure it out. And it usually goes private health insurance gets billed first, then Medicare, then Medicaid. Whatever isn't paid by the others, Medicaid is. So later in life, if they're Medicare and Medicaid, if they're dual eligible, it's a pretty sweet deal because they usually don't have many co-pays or things they have to pay out of pocket because Medicare pays and then Medicaid pays the difference. So Charlene, I'm going to get to some of these questions here in just a moment. So, the Medicaid can be used as a sole health insurance. If you're not employed and you aren't able to offer your child health insurance, they can use their Medicaid as their own health insurance. You will need to find medical providers and vendors that accept Medicaid. And then you'll also see billboards and advertisements about Medicaid managed care plans. This could be the Ohio Buckeye, WellCare, Anthem has one, Molina. These are private health insurance companies who are working in tandem with Medicaid to provide above and beyond Medicaid health insurance services. So there's a lot of nuances to all these different types of insurances and how they work with one another. Again, you're welcome to call me anytime and talk to me about your specific needs. But for the purpose of this conversation, once your child turns 18 in 1 month and they apply for SSI to get supplemental income to help them manage their living arrangement while they look for a job or are in a program trained for a job, things of that nature, then they are automatically eligible for Medicaid, and it is a good health insurance to have as a backup or as in tandem to other insurance that your family might already be using. So with that said, Medicaid is health insurance. Medicaid is the funding source if your child is getting a waiver from the state of Ohio, regardless of what kind it is. You must be Medicaid eligible. There are different types of Medicaid. So as your child ages, there is one called the MBIWD, and that stands for the Medicaid Buy-in for Working Individuals with Disabilities. And the reason this was created years ago, it was to keep people out of poverty. When you're in Medicaid, you're a little stymied. You only get this much money. You can only have this much in resources. I can't save any money. If I work, I lose my Medicaid because I'm over income. So they created the MBIWD, and this allows people to earn more, and this allows people to save more. So the resource limit is increased. I'm looking at for my cheat sheet. This year, I believe the accessible amount is $15,548, which is a huge difference between the perpetual $2,000. Now, what I want to remind you is there are people who work and they're still on SSI because they haven't worked enough to work off of SSI. SSI is a flat $2,000. You don't want to go over the $2,000 limit or you will lose whatever SSI income you are getting. So let's say you work a small part-time job to build independence and some type of earning experience, but you're still getting monies from SSI. We would not apply for you for the MBIWD because you wouldn't be able to go over the $2,000 limit, because once you're over the $2,000 resource limit, you lose your SSI income. So this would only be for people who have worked themselves off of SSI and want to keep their Medicaid for a waiver or for other reasons. There is an ability to do that. There also is an ability to put your monies in safe, appropriate places to maintain Medicaid eligibility. One of the best tools that came around about 15 or 16 years ago is the Stable account. Federally and nationally, it's called ABLE, A Better Life Experience, and it's managed by your state treasurer's office. This is a fund that has a cap of deposits every year, but it's also a portfolio if you'd like to use it for investment purposes for the person that you support. But in Ohio, they call it Stable. I'm not sure why, but they do. So that account is not accessible in the sense that Medicaid will not penalize you for using it. So if you find that your child is going over the $2,000 resource or getting close to it, you can open a stable account, have it linked to their checking account, and have that overage, quote unquote, money siphoned into the stable account all throughout the year. Now, there is a cap on that. It's not like a revolving checking account. You can't put money in, take money out, put money in, take money out. It's a cap of, I believe this year, I'm looking for my note, it's $19,000. Or what is it, 20 now? Thank you, $20,000. So once you hit that 20,000 cap of deposits for the year in stable, then it won't allow you to deposit anymore. Even if last month you took $5,000 out to do the trip of your dreams, it has a cap of deposit. So we always tell people of young children, young adults, when you're setting up your life insurance policies and setting up how you want to support your child after you're no longer here, you're going to want to reach out to a special needs attorney. There's many here in the state of Ohio that are really, really good. And Jenna, I can send you the list that we work with all the time. And these attorneys, all they do is help people with guardianship, stable accounts, and irrevocable special needs trusts. And this is where you can have monies put in there later for when you're not here, so that they can be assured that they have funds to live on after you're gone and you're not able to manage that for them. And while we're on the topic of guardianship, regardless of the ability or disability of your child, when they turn 18, they are their own person. They are their own guardian, regardless of their abilities. So if you are contemplating becoming a court-appointed legal guardian, I highly recommend that you work with a special needs attorney and learn all the nuances of that. Many years ago, I had an elderly woman who told me, "Oh no, he's not his own guardian. He's retarded. He can't do anything." And this was, as you can hear by the verbiage, this is a really long time ago. But the problem was he was his own guardian. He was 52. He was his own guardian because nobody became his court-appointed legal guardian. So in the event of any type of hospitalization or legal choices, he had to sign and he had to be the one to make the decisions. So as your young adult is progressing in life, you're going to want to seek advice and counsel on what would be appropriate. It could be power of attorney, it could be power of medical attorney, it could be guardian of person, it could be just guardian of estate, meaning you just the guardian of their income, but they still make their own decisions. So there are a lot of nuances to legal guardianship. So you will want to work with somebody who can help you navigate that system. But once they turn 18, they are their own guardian. They will be expected to sign things unless that has already been established, unless you have already done that and right away become the court-appointed legal guardian. And that addresses, I think, Charlene's account, or Steve asked, does a child need to have their own power of attorney for benefits? They don't if they're able to make their own decisions. But you can get power of attorney for different things. Again, I don't know how those stand up in court for different personal decisions. But the benefits can also be managed by, for example, we have a team of benefits representatives, meaning they're the authorized representative who manages the Medicaid for that person. It doesn't have to be somebody through your DDS system. It can be a family member. It can be someone you trust. If your child is on a waiver and they're living with a provider, it can be the provider might do that for you. It is a way for the person's Medicaid and SNAP benefits to be managed not by them, but by somebody else. So they don't have to have a power of attorney, but you will want to reach out and seek legal representation and advice on how to set things up, appropriately. Do benefits off automatically stop?
Can I chime in on that?
Yeah.
Um, so from the Social Security perspective, when you apply and the child with the disability gets approved, sometimes they dictate, Social Security will tell you that they need a representative payee, which means that someone else will have to be in control of their funds because through the whole process of them being determined disabled, they have discovered um, that they cannot manage money. So then there's a special checking account, not a special checking account, it's the wording. It would say Di Sutherman rep payee for Teresa Schlimmer. And then that way I cannot access that account, but Di has control of my Social Security funds and she'll be able to manage my money for me since I am not adequate enough to do math to pay my bills. Hopefully that helps somebody.
And Charlene, I don't understand. Do benefits automatically stop at 18 in 1 month? Did you mean start? And how long is the application process? Are benefits retroactive during the application process once approved? I'm assuming that's
That
all.
might be Social
I was going to
Security.
say, is that all Social Security question?
Charlene, is your child receiving Social Security? Somebody.
Oh, the child is already on SSI.
Okay, he's already on SSI. How old is the child? Okay. Okay. Charlene, the child would not be on SSI at this point. He would be on Social Security. Is there a parent that's deceased that he's drawing off of? No. Hmm. Okay, well, you're throwing me for a little bit of a loop here because I've never heard of that. Um, it would have to be parents' income. Do your dad not work, Charlene? Sorry to ask personal questions. So when they turn 18 in 1 month, I do not work because I have two kids that are full care disabled. Okay. So your income made him eligible along with his disability. It should not, since he's already been determined disabled by SSI, you will not need to reapply then in 18 in 1 month. It will just continue. You're welcome. Sorry, Di, to interrupt.
No, no, that's fine. I'm glad. Um, And then the stable account, we have representatives at Hamilton County DDS that open stable accounts for the people we serve all the time. This was especially very much needed during the pandemic when everybody was getting that $2,400 check that to help you through the crises, the economic crises. But the problem was the people we support had a $2,000 resource limit and you weren't allowed to go anywhere and you weren't allowed to do anything. So the money couldn't sit in your bank account or it would make you over resource for Medicaid and SSI. So we quickly learned and helped people get the stable account, but they're very, very easy to work with and they have a customer service like no other. So if you get on that stableaccount.com and just go to contact us and put a call in, they will walk you through it. You can do it online. You can link it to a bank account. You'll want to link it or set it up where you are the manager and they are the beneficiary. And then you just want to maintain just how much you deposit each year. For young adults who are on Medicaid, I often recommend it to families instead of giving people cash at Christmas or birthdays, make a deposit to the stable account. They can withdraw that money anytime and use it for whatever they want. It's for a better life experience. And the difference between the stable and the trust is the trust is just for extraordinary purchases. It's not for anything based on your living arrangements. So it won't pay rent. It won't pay food. It won't pay utilities. That's what your Social Security income is for. But it will pay things like furniture, a trip, passes to places, things that are above and beyond your living needs. The stable account will pay for anything as long as it creates a better life experience for you. So it can help contribute to rent. It can help contribute to food if you don't have enough income for that. So I just want to make sure, let's see. All right, so we've covered all the questions, I think, so far. Hang on. Okay, so Bo, any earned income is not a resource limit the first month. The earned income is income. So whatever you earn, let's say in the month of June, it's your income. It's not part of your resource limit. But when you go into July, if you're over the $2,000 limit when you go into July, then that income that you did not spend becomes a resource. It's like money that you saved or you didn't use. So when monitoring the limit, it it never counts the income for the first month. It becomes countable the second month because you didn't spend it all. So if you're the the best way I tell families to do this is open the stable account, and every month, if you know next month when that Social Security income check is going to come, it's going to put you over $2,000, just go ahead and transfer the difference to stable. And that way you still have the money. It can be used later and it can be used for anything you want, but it's not going to mess up your government benefits, SSI or Medicaid. I hope that was helpful. And while we're talking about living expenses, I don't know about you, but my grocery bill is atrocious. So if you're also supporting teenage youth, they eat a lot. And so your grocery bill gets even higher. We have a lot of families who come to us when the child turns 18 and asks, can they now get food stamps? Can they now get their own food assistance? And the answer is no. If they're living at home, being supported by family, they have to wait until the age of 22. If they've moved out at the age of 18 and they're living in a living arrangement where they're contributing to rent and utilities and things of that nature, then yes, they're eligible to apply for SNAP. SNAP is now what they used to call food assistance, what they used to call food stamps, what they used to call welfare. And SNAP is a supplemental nutrition something program. It's a federal program. So if you're on SNAP, it can be used anywhere in the country if you have an EBT card. SNAP is a federal program. And to get SNAP for young people, they either have to be 18 living on their own, supporting themselves, or after the age of 22, living with family, they're welcome to apply. Thank you. Nutrition Assistance Program. I couldn't think of assistance. So, and this is something I'm going to get on a little bit of a soapbox. I advocate for this wholeheartedly. One, they're eligible. Two, your tax dollars have already paid for it. So try to get some of your tax dollars back. But most importantly, if a young adult is living at home that has disabilities and can get SNAP, this is the best tool you can teach them to gain independence. They can make their own grocery list. They can learn how to budget their SNAP amount. They have an opportunity to have a little bit of confidence about I'm contributing. I'm paying for something for myself. Even if the person you have at home isn't verbal or doesn't read or write, you can take one of those paper food ads and have them circle the items that they might like to buy, go to the store, and they use their EBT card and they're purchasing uh, on their own. So it's also a benefit that later in life, should they not be able to live with family anymore and have to move into a different type of living arrangement, they will have to have this in place to assist their individual budget. So the best teachers are those people who are already teaching them life skills. And this is an important life skill for all of our young people to know: healthy choices, budget, confidence. Maybe they're going to have friends over and they're going to buy some of the party food. And how big of a feeling is that, your son or daughter, they had a party and they provided everything. They paid for it. It was their party. So there's lots of nuances from my standpoint, and it is my own personal soapbox, that we do encourage all the time that once a person is eligible for SNAP, please apply. We'll get them as much as they can get based on the calculations. And it's a very simple calculation. How much money do you have coming in? How much money do you have going out to pay for rent and gas and electric are the big utilities that they charge? Or maybe you have some out-of-pocket medical expenses. They'll consider that as well. But the SNAP is a federal program, and we do assist people in getting that. In our county, we encourage that anyone who is eligible for Medicaid apply for SNAP. See if you're eligible for it, because instead of paying $50 a week out of my personal funds towards groceries, I can get on a program that's going to give me $200 a month towards my grocery bill. Then that opens up that $50 a week that I was using for groceries for other personal expenses. Getting my hair done, getting my nails done, buying new clothes, going to Kings Island with my friends, things like that. So always consider all of the different benefits because the word is in it itself. It's a benefit. It's designed to be beneficial. And I know some people are like, oh no, we support our own, we pay for our own, and that's very commendable. But there's going to come a day that maybe you can't. And so to have this in place already is one transition that they won't have to deal with, later in life, that it'll already be established. So we've talked about Medicaid. We've talked about SNAP or food assistance. We've talked about Medicare being a federal insurance health program. And we do have young people who are on Medicare because after 24 months of drawing off a Social Security account from a parent's work record, you're eligible for Medicare. And the other program, we've talked about stable accounts, how to safely save monies, and trusts. And I will send to Jenna a list of attorneys and guardians and other agencies that help people navigate a lot of this. And they're all very good. I've been to all their seminars, all their webinars. They also usually have a personal reason they're in that field. So they are huge advocates for the people that we support. And so I can't ethically recommend one over another, but they're on our list because we've worked with them and we find them to be very reputable. So I'll send those attorney lists and agency lists to Jenna. So I have talked probably too long. So why don't I take a breath, and then you all can either open your mics and ask questions or put them in the chat if there's anything that has come up in your head that maybe we didn't touch base on.
I've been trying to keep up with the chat.
Mm-hmm.
There are a lot of great questions in the chat. So, let's just go up to the top so we don't lose any. You answer the question about earned income. Um, let's see. So there's a lot of questions about the stable account. We did have a session just like this, specifically on the stable account. The Treasury Department came and did a session just like this. We did record it. So I'm going to put the link to that recording in the chat so everyone can hear more information specifically about the stable account. And that is coming directly from the Treasury Department. So hopefully that will be helpful for folks as well. And if you have questions like Di mentioned earlier, and I'll just put this out there. I utilize the stable account for my son. He's 16 and has a disability. And it's so easy to set up. And if you don't have somebody like Di to help you do it, but online, and they're, like she said, the customer service is fantastic. So they will answer any questions that you have. They will walk you through the steps, and they always answer the phone. You don't have to wait forever, and you don't have to, it's it's like you're calling up your friend almost. So,
Mm-hmm.
so just, if you have any specific questions, I would suggest you just call the treasury or the stable staff
And
directly.
there's
They're
a
very,
lot of nuances to the stable account. So maybe you'll be managing
there
at the
are.
beginning, but you can get a debit card attached to the stable
Yes.
account. And then that also teaches budgeting, independence, growth, because they are then able to access their funds if you want to just say no more than $200 on the debit card for protection of, what if it got stolen or something like that. But it's a great tool to start using for youth and young adults to teach about you get this much money if you would like to use it to be with your friends, buy certain things, go to the movies, go to the, concerts or whatever. This is what you have to use. And then once it's gone because that's life. Once your income is gone, it's gone. So we highly recommend them. It's a great way to balance Social Security accounts, so you never have to worry about being over the resource limit. It really is an awesome tool. And we're very lucky the state of Ohio joined on that bandwagon and set that up for everybody. And it can be an investment. There are 4 different platforms you can use. So if you're in the world of finance and you're interested in that, there are ways that money can use to work for them as well.
If anyone wants to just unmute and ask a question, why don't we do it that way? Because I have lost track in the chat.
We're
So
okay.
if, yeah, so
We're good.
if you would like to just unmute and ask a question, feel free to do that at this point.
Hi, this is Steve. I guess I'm a little confused about the stable account and the resource limit, um, and how that works. Where, if you're providing some funds in the stable account, does that impact, that $2,000 limit or
No,
any other?
that's why it was created. It's a way that people with disabilities can save money, can work themselves out of poverty. The stable account is not counted as an accessible account towards government benefits, SSI or Medicaid. Unlike a bank account, a checking account, a savings account, a CD, those are countable. But the stable account has nuances and was built to define that specifically. It's not counted towards your government benefits.
Would it be good to transfer some of their money from their SSI benefits into that account? Or would it
Yes,
be
I recommend that to families all the time. If you're not utilizing all the monies that they're getting each month, for whatever reason, just take what they didn't utilize every month and put it in the stable account. Then you're never over the resource limit of the actual checking account. Stable will not take SS income deposits. Those have to go to a regular bank account, but you can move that money into a stable account anytime you want.
so would it be a good strategy to have the child's income directly deposited into the stable account instead
They
of
don't
just
allow it. That's what I was
okay,
just saying. They
okay,
don't
okay.
allow that. You have to put it in a regular bank account, but it can be moved immediately into the stable account if you want. That would be a personal preference on how to manage money. Typically, what I say is you must always keep a person who uses benefits, their money can never commingle with anybody else's money. So if you have young adults that are starting to get Social Security income, please do not have that deposited into your checking account where your income goes. Because now it's called commingled, and all the money's in that account they think belongs to the child, even though it looks pretty clear, but they don't know who's using what money. It's very typical as when you go to a party and everybody throws $10 in the pot to help pay for snacks and people start taking money out. Nobody knows how much of that money of yours is left. And that's how they look at a joint or a commingled account. So you always want to set up the representative payee account and manage all of the person who's on government benefits. Write checks, make a paper trail, use a debit card, get a statement. You always want to show how their monies were spent for their benefit and never have it touch your money. And you can do that with a stable account because they'll give you a statement every year showing you a transaction of money that went in and that went back out.
Um, different topic. Uh, I've been working with someone. I'm in Montgomery County, and I've been working with someone in our county for guardianship. And um, I guess I'm just wondering whether it would be better for me to go through an attorney. They've been great, and I think that the information they're providing is spot on. But would you still recommend going through one of the attorneys just to make sure that we get everything set up appropriately?
I don't want to speak out of turn. I don't know who you're working with. There are agencies that'll do this for you. There's personal guardianship agencies. But if you have any qualms about it at all, the list that we'll be sending, they'll answer questions for you. And you can make an educated decision then on which way to do it. Um,
Or call your local legal aid and they might be able to
Yeah,
help you a
legal
little
aid can
bit.
help you, or you can talk to somebody at in probate court because that's where it's all going to manifest anyway. So, let's see, Charlene. Yes, yes. I definitely, in your situation, I would be opening accounts where only their money is deposited. And don't have the two children's money mingle either. Just keep everybody's money separate. We find that that works best for because you have to at Social Security as well as Job and Family Services who monitors the Medicaid. You have to show everything, the money that you got, how you spent it, why you spent it, and how it benefit the person who received it. They scrutinize that because I just want to remind everybody, Government benefits are not free. You do have accountability towards that. So you have to follow the rules and guidelines of the eligibility of the program. So if they ask for something, you have to produce it. And just to make it easy for every person who uses a government benefit, although I totally understand one account and bills just get paid from one account, it will be so much better for you later in life if you're just managing each person's account independently. And then as they age into adulthood, that'll become even more important.
Okay, I want to go back to Charlene. Charlene, if you don't have a bank account yet for your child, if there's no income coming out, I personally would wait until they got approved for SSI, because if you set up a checking account with just your child's name and you on it, and then they decide that he or she needs a rep payee, you're gonna have to set up another account, which just becomes too confusing. So if you're in the process of getting SSI or applying, I personally would wait until he turned 18 in 1 month and he was approved for SSI. Then you can set up the account that says Charlene rep payee and then your child's name, because that's what's going to be required by the law. Does that help you? Great. So Amanda, your son is now 18, has a dual diagnosis. He was going to apply for S, but not qual. Would this affect him qualify for S? Okay. So he will not qualify. You won't apply for SSDI. What you're going to apply for is SSI. SSDI is based on his work come. Since he's 18, I'm sure he does not have enough work credits. And you and your husband may not be drawing. SSI has to determine his disability first at 18 and 1 month. Then they will call them, then he will be approved for SSI. SSD, you can't apply for SSDI now. So you need to make an appointment. You need to make an appointment. You're welcome, Amanda. You need to make an appointment with SSI. So just call your local Social Security office and then they'll set up the appropriate appointment to give you and go from there. That's where people get confused because they think their child has a disability. They go online, they apply for Social Security disability, and then they get a denial letter almost immediately because that's not the right benefit that you're wanting to apply for. So when you call Amanda, just tell them you would like to apply for SSI for your child. No problem. That's what we're here for.
Okay, any other questions out there? We're almost to 8 o'clock. We have a few more minutes to get another question or two in if you need to.
Just email after this. There's no such thing as a dumb question. I know it's as clear as mud. I deal with it every day. Recently, I was doing a Social Security application and they actually changed the format. And when I talked to my person at Social Security, she said, "Oh, thanks for letting me know. I only work here." And I said, "Well, that's okay. The element of surprise always makes the day challenging."
Wonderful.
I have a question.
Go right ahead.
What?
Yeah, well, my daughter just recently turned 18, and I did all the things within weeks of her turning 18, not realizing that she needed to be 18 in 1 month. I applied online for SS. I'm not sure what I applied for, so I think it was the wrong thing since Teresa said you can't apply for that online. And also for Medicaid. So it seems like what I should have done was just make an appointment at the Social Security office and get that approved, and then the Medicaid would flow through. Is that
Correct.
right?
Correct.
Okay.
Yeah. You just call Nicole and tell them you would like to apply for SSI. Your child has a disability.
Okay.
And then once they're SSI approved, then they're Medicaid eligible. You may have to go to the Jobs and Family Services. Here in Hamilton County, we're having a little conflict. Sometimes our people who get eligible for SSI, they automatically enroll them in Medicaid and they're good to go. Some
Hmm.
cases that doesn't happen. So every county is a little different. I would just, once they're approved, you can reach out to Di and she would tell you what you need to do to apply for Medicaid.
We have a whole packet I could send it to you
Yeah.
of with instructions, what's needed and why it's needed.
Right. That would be great.
Di, you're welcome to send that to me. I won't send that out to everyone, but Nicole, I'm happy to send that to you. And then if there's anyone else specific.
Yeah, let me get that. I just sent one today. I got it right
Oh,
here.
great.
I'm
Thank you.
creating a list of things I'm sending to you right now because we're off tomorrow for this observation of the
Yes.
Juneteenth holiday.
Yes.
So I have different lists of attorneys, some here in Hamilton County, and the other one is Central Ohio. It's in the Franklin County area, so if that would be useful to the group. And then I have the Medicaid application documents, and it's an instruction sheet as well as the forms that you would need to apply. And I don't have a message in the body. I'm just sending the stuff. So
Okay.
Yes, that would be wonderful. Thanks, Di.
you're
Appreciate it.
welcome.
Thank you.
I-
And I did open a stable account for my daughter. It was very easy to do. I'm glad that's there for us.
Right.
Oh,
Thank you.
yeah, it has been such a blessing to so many people. And I will tell you, especially for during that time when people were getting money that you could not use. You know, you were getting that, what was that called? Um, oh, I forget. There was a word. It begins with an S. This is my age showing. But it was to help accommodate people during the pandemic who were in economic crises. And uh, so
A
oh, my
moratorium.
computer is telling me it's going to close out in 4 minutes. But anyway, yeah. So um, the the monies
Stimulus.
was great, but you couldn't use it. You couldn't go anywhere. You couldn't do anything with it. So then they were in trouble of losing their benefits because they had too much money in their accounts. So the stipends, that's the word, stipend. Everybody was getting a stipend.
Um, just a quick question before we close here. My daughter's been receiving survivorship benefits,
Mhm.
but now that she's 19, do I need to reapply to SSI because it's
It-
going to be it's going to be under her disability instead of the survivorship?
no, it will still be under survivorship until they decide it's no longer.
Well,
Just
they've told me that it's going to be no longer because
so,
she's graduated high school.
okay. Okay. So they should be sending you paperwork, Steve. That's how it's supposed to work. And then you just have to fill that out and then they will do a disability assessment. You don't have to do the whole reapplication.
Okay. All right. Thank you.
You're welcome. If you don't get that within the top, like 2 months after she graduates, then reach back out to them so that a lot of lapse of time goes by. But that's how it's supposed to work.
Ah, thank you, Charlene. A
Okay.
stimulus. Yes, the stimulus check.
Just reach out if there's
Thank you
anything after we
both.
close out.
Yeah, thank you both very much. We appreciate your help. I just got your email, Di, so thank you for sending all that great information. I learned so much tonight, and I work in this every day too, and I still learned so much. So I appreciate you both immensely for being here and for helping to educate us and making this process just a slightly easier than maybe it was before we had tonight. So we appreciate it. Again, if anyone has any questions, they're welcome to reach out to me as well. If it's more broad, certainly reach out to Di or Teresa for SSI and Medicaid. But we do navigate all systems through our organization too. So if you have other questions, concerns, I'll just put my email address in the chat here, and you're always welcome to reach out to me as well. Okay, thank you
Well,
all
thank
very
you.
much.
Thank you
Have
for
a
the
great
invitation
evening,
and
have
thanks
fun on your
everyone for
vacation.
coming. Yes, thank you. All right. Bye,
Take care.
everyone.
Bye.
Bye.